Good afternoon, everybody. This is the meeting of the Thurston County Board of Health, 10/14/25. Meeting will come to order at 3:45. And first item on our agenda is approval of the October 14th, 2025 Board of Health meeting agenda. And if there is a motion to approve, I will take it. Eddie Knadel moves and second Commissioner Menzer. All those in favor of approving the October 14th meeting agenda, please say yay.
Aye.
Okay, do you say a? Aye.
Aye.
Yay.
Aye.
Oh,
Aye.
and we have a hand up. All right, any opposed? I will take any negative words there. Okay, so the October 14th, 2025 Board of Health agenda is officially approved. Next item on the agenda is approval of the September 9th, 2025 Board of Health meeting minutes. And if there is a motion to approve the September 9th, 2025 Board of Health meeting minutes, I will take it.
So moved.
All right, Commissioner Klaus, and a second.
A second.
And Perla Picha, Tanzania. So Perla gets the second. All in favor of approving the meeting minutes from September 9th, say yay, aye, or whatever you want.
Aye.
All right, any opposed? All right, I think the September 9th, 2025 Board of Health meeting minutes are approved. So the next order of business is to proclaim October as Domestic Violence Awareness Month in Thurston County. And I would like to invite Gretchen Teller, Community Health Division Director, to introduce our speakers.
Good afternoon. Thank you, Board of Health members, for this proclamation recognizing domestic violence. I am going to introduce our speakers, but I just want to say that domestic violence, if any child witnessing domestic violence over time is going to leave a lasting impact on that child. So often we forget about children in this piece of it and think about, you know, the parents. So I think I just want to call that out, that it makes a difference, and we see difference lifelong for those kids. So with that said, I'd like to introduce Dan Hillard from the Family Support Center, and then also Emily Ledegy, sorry, from the PAO's office. And then Sheriff Sanders also would like to say a few words. So if you'd like to come up and join us at the table, that'd be great. Just right up here. Yep. You get to have a seat. Okay. Thank you. Oh, right, okay. Want me to try?
Yes. Okay. Hi, I'm Emily Ledegy. I'm from the prosecutor's office, and I thank you all for allowing us the opportunity to speak. I'm here with most of my colleagues from the domestic violence team, along with our chief of staff. And we want to thank the board for taking time to acknowledge this month and for your continued support of the work that's being done in our county to address and prevent domestic violence. We're really proud that October is Domestic Violence Awareness Month because it's an opportunity for our community to come together, to honor survivors, remember those who we've lost, and reaffirm our commitment to breaking the cycle of abuse and why we are truly committed to doing this. Domestic violence is not just a private issue. It affects every corner of our community. Just as we were speaking earlier, this impacts all the way down to children. It impacts families, workplaces, school, safety of our community, as well as the well-being of our neighborhoods. In Thurston County, our office works closely with law enforcement, victim advocates, community organizations, and shelters to support victims and to hold offenders accountable. Last year alone, our domestic violence unit handled one of us handled cases representing a person, a family, and a story of courage. We handled, so far this year, 387 cases at the felony level, and we charged 298, with about 10% being Class A violent crimes. We've also charged, out of 406 misdemeanor cases this year, we've also charged 298. There are also specific high-risk cases that are from the Thurston County Sheriff's Office. There's 13 active ones in the felony level. And we recognize that every case that comes through our office, there are many more victims who suffer in silence. We want to say to those individuals that you are not alone. Help is available and our community stands with you, believes in you, and is here to help find safety and justice. Awareness alone isn't enough and it must inspire action. This month, we encourage everyone in our community to learn the signs of abuse, to reach out if you suspect someone is in danger, and to support the organizations that provide critical services to survivors. Together, we can build a community where safety, respect, and equality are all the normal. Thank you again, Commissioners, for recognizing October as Domestic Violence Awareness Month. Your support helps shine a light on this issue that thrives in silence, and it reinforces our shared commitment to ending domestic violence in our community. Thank you.
Yeah, would you like to go next?
Yeah. So, good afternoon, Board of Health members, and thank you for this important proclamation. Recognizing October as Domestic Violence Awareness Month. My name is Dan Hillard. I am the Family Justice Center Program Manager at Family Support Center. On behalf of the Family Support Center and the Family Justice Center, I want to express our gratitude for your continued commitment to survivors and families in Thurston County. This proclamation is more than a symbolic gesture. It's a reminder that domestic violence impacts every corner of our community and that safety, healing, and justice require all of us working together. Every day, survivors make incredibly brave decisions to seek help, to protect their children, and to rebuild their lives. Our advocates, law enforcement partners, and community agencies stand ready to meet them with compassion and support. In the last year, our organization alone served more than 1,000 survivors of domestic violence with comprehensive advocacy, housing, rental assistance, therapy, parenting support, safety planning, and much more. Thank you for standing with us, for believing survivors, and for helping build a community where everyone can live free of violence. I have some flyers with upcoming events and fundraisers that I'd like to leave with you guys. I will leave them here for now.
Thank you.
Well, good afternoon, Board of Health. Thanks for having us all here today. You know, I'm thinking about kind of the umbrella of domestic violence and what goes into that, and obviously from a law enforcement perspective. I've always said this, I feel like when we get involved, it's already too late. Not too late to fix things, but too late to acknowledge that it could have been prevented in the first place. So I think it's important to understand that law enforcement's a small piece of this pie when it comes to domestic violence, especially the prevention of domestic violence. Anecdotally, through my career, and even before that, you know, I was 5 years old when I first experienced domestic violence and saw my stepdad get arrested. And so going through that in my career, one of the driving factors that I've personally noticed in a lot of our serious IPV cases, the interpersonal violence, is when we get into socioeconomic factors, that seems to be a very large driving factor. The stress in households ultimately causes some of those issues. But the one thing I would say is, you know, acknowledging that sometimes there are going to be people who are missed and they fall through the cracks and they end up in a law enforcement scenario where we're responding. Obviously, it's one of those calls where it's probably the most high risk call that we go to, are these very intricate, you know, power and control dynamic type domestic violence incidents. That's ultimately the ones that we've gone to where we've had a lot of shootings. We've been involved in a lot of critical incidents. But the one thing that I will say is that law enforcement traditionally, the really like sexy, exciting stuff, we're really good about specializing in that, right? You guys got the SWAT team. You've got the traffic team who handles, you know, serious injury collisions. You know, we've got detectives who handle, you know, like crimes against children, but we've never really done that for domestic violence. The closest we've gotten to is in the past, the sheriff's office has had like a DV detective who would like filter through the most high priority DVs and try to do some follow up. One thing I'm really excited to announce is that going into January of next year, we are actually taking 2 detectives and we're kind of putting a spin on it. So they'll have all the expert knowledge of domestic violence, child interviewing, because a lot of times the kid is our one witness who can kind of determine a primary aggressor. And we're actually putting them in patrol cars out on the road, responding to DVs as the first responder, not someone who's taking a referral off the desk. So I think that's going to dramatically change the not just the outcomes of the cases sometimes for the prosecutor's office, but also the experience for the victim. Traditionally, I think the average patrol deputy with the training we get is just significantly underwhelming or significantly undertrained to really deal with some of these high level cases. You know, historically, as a deputy, you would handle a felony strangulation case by yourself. That's totally normal, and that's just a lack of detectives. But with staffing improving, we're really starting to focus some of our efforts on the domestic violence stuff because it is one of our larger caseloads. I always tell people in Thurston County, violent crime almost non-existent unless you know someone. That is where our violent crime rate is actually being driven here in Thurston County. So I'm really excited to get to the point where I'm hoping these detectives will become subject matter experts for the prosecutor's office as well for follow-ups, all the things that we're not really doing in the domestic violence world right now that will potentially save lives in the future. So I'm really excited about that. And again, thank you guys for taking the time to acknowledge the very real impact, because I don't think at this point in time in our society, you can go very far without finding someone you know who's been impacted by it.
Thank you all so much for coming. So we'll read the proclamation now, and then we'll go take a picture out in the lobby. So let's see, are you feeling okay starting at Heidi? Okay.
Thurston County Proclamation, Domestic Violence Awareness Month. Whereas Domestic Violence Awareness Month is observed every October to raise awareness of the devastating impact of domestic violence and to honor the strength and resilience of survivors. And
Whereas domestic violence affects individuals of all backgrounds and generations, and the Thurston County Board of Health recognizes it as a critical public health issue with lasting physical, emotional, and psychological impacts that require a coordinated community response. And
whereas the Thurston County Prosecuting Attorney's Office has charged 568 domestic violence cases and provided advocacy to over 990 victims so far this year. And
whereas the Thurston County Sheriff's Office deputies responded to 1,380 domestic violence 911 calls so far this year. And
whereas the American Academy of Pediatrics reports that 1 in 4 children is exposed to intimate partner violence or domestic violence in their lifetime, and that this can have an adverse impact on their physical, psychological, and psychosocial health well into adulthood.
Whereas local organizations in Thurston County provide critical survivor-centered services, including crisis support, shelter, legal advocacy, and culturally competent care to individuals impacted by domestic violence, sexual assault, stalking, and human trafficking. And
whereas the 2025 national theme, With Survivors Always, reminds us of our shared responsibility to advocate for survivors' safety, support, and solidarity throughout our neighborhoods, workplaces, and institutions.
Now therefore be it resolved, the Thurston County Board of Health hereby proclaims October 2025 as Domestic Violence Awareness Month in Thurston County and urges residents to honor the lives of those impacted by domestic violence through participation in education, advocacy, and community service. Adopted this 14th day of October 2025.
great.
Is it still a thing that we wear purple in domestic violence awareness month? Oh,
You're
cool.
all
Awesome.
perfect.
yeah.
That was intentional.
Yeah, so I'll invite everybody to meet out on the stairs and we'll take a picture.
Well,
thank you.
it's like a Marshall lookalike.
All right, so we had one speaker who came who wasn't on the agenda, so I wanted to invite Kayla from St. Please up to say a few words if you'd like to. We'd love to have you.
yeah, hi, thank you guys for bringing me back in. My name's Kayla Emerson. I'm the Prevention and Outreach Program Manager at Safe Place Olympia. We support survivors of intimate partner violence, stalking, sexual assault by providing advocacy, resources, emotional support through court, a confidential high lethality shelter, as we work to create a life free of violence for themselves and for their families. I'm honored to be here today to proclaim October as Domestic Violence Awareness Month. We believe that spreading awareness can be a huge first step in battling the war on domestic violence in our community. We want to note as well that over the course of the other 11 months of the year, the statistics continue to rise. It's 1 in 9 men and 1 in 4 women who've experienced severe domestic violence at the hands of an intimate partner. The first half of 2025 experienced an increase of 3% of domestic violence arrests. That is just the first half of 2025 with expected rises to come. And these are only the numbers that were reported to law enforcement. So acknowledgement of domestic violence during the month of October brings a sense of solidarity and resiliency to our community, especially during the current state of funding for in-kind organizations. But I challenge community today, let's fight this every day, every month, every year. Together, we can combat domestic violence. We can support survivors, support and grow healthy families, and prevent the perpetuation of domestic violence in the future. Thank you, guys.
Yeah, and thank you for all the work that you do.
Thank you.
Yeah.
I have a quick question.
Yeah, sure.
So, how long has Safe Place been around?
We are going on, I believe, 45 years now.
Okay, yeah.
We've been around as the primary CSAP for a very long time.
I'm reading a book and it's talking about Safe Place in the 80s, you know?
Yeah.
So, and I was like, wow, I didn't realize it.
It's the core values of the mission has always been the same. We have experienced cuts because of funding, so we no longer have funds to help with housing support, but we still do everything we can in way of referral. We work really hard with Family Support Center to be able to house those people and just do everything we can to get them back on track with what we have.
Thank you.
Yeah.
Yeah.
Any other questions?
Thank you, guys.
All right, yeah, thank you so
Thank
much
you.
for coming back.
Yeah.
Right, the next order of business is to proclaim October 24th, 2025 as International Day of Climate Action in Thurston County. So I'll invite Susan Long, Corey Carlton, and Siri Nelson to say a few words.
Thank you so much for allowing us this opportunity. With me today, I have Corey Carlton. She's a program manager with Washington State University, Thurston County Extension, WSU Master Gardener Program, and the Master's Recycling Composter Program with Thurston County. And we also have Siri Nielsen. She's an education program manager with Lot Clean Water Alliance. And I'll turn it over to them to say a few words about all the great work they do.
So I get to start. So welcome and thank you for having us. Washington State University Extension Master Gardener Volunteer Program was founded in 1973. The Master Gardener concept has been replicated across the United States and internationally. Locally, we have 200 volunteers that serve our Thurston County community. Each year, we train new volunteers, equipping them with relevant, unbiased, research-based knowledge to become horticulture educators. The needs of our communities have evolved over the years, and Master Gardeners have evolved with that in meeting the challenges for today. We have 9 program priorities: climate change, clean water, water conservation, soil health, local food, pollinators, plant biodiversity, nearby nature, and wildfire preparedness. The WSU Extension Master Gardener Program helps to combat climate change by equipping home gardeners with science-based knowledge and practical tools. The program empowers individuals to adopt sustainable gardening techniques. By embracing climate-conscious practices such as planting drought-tolerant and native species, conserving water through efficient irrigation methods, improving soil health with composting and mulch, and creating habitats for pollinators and beneficial insects, gardeners contribute directly to mitigating the effects of a changing climate. These efforts not only enhance our health and individual gardens, but also have a ripple effect throughout our entire local ecosystem. Master Gardeners help translate complex challenges into actionable solutions. Their service supports a network of gardeners who are prepared to respond to environmental changes with confidence and innovation. The WSU Master Gardener Program is happy to celebrate International Day of Climate Action today. Thank you.
All right, hello. Thank you for the opportunity to speak to you all today. LOT provides wastewater management services for the urban areas of Lacey, Olympia, and Tumwater in Thurston County, Washington. LOT's mission is to protect public health and the environment by cleaning water and recovering resources for our community. LOT helps support the regional goals of the Thurston County Climate Mitigation Collaborative by conducting annual emissions inventories, sharing data, and working to reduce our carbon footprint. LOT is currently developing a climate action assessment to identify opportunities to further reduce emissions over time. Currently, we have reduced our greenhouse gas footprint by 30% overall, or 42% per capita from the 2015 baseline. And at LOT's Wet Science Center, located in downtown Olympia, our goal is to educate our community about water, sustainability, and the environment. With a focus on wastewater treatment, we encourage folks of all ages to explore the interconnectedness between all of us, the built environment, and Earth's systems. Systems thinking is a key to understanding climate change, the impacts, and the solutions. We fulfill this objective by providing free, fun, and accessible science education programs to the community through school field trips, community outreach, and weekend events. We serve over 12,000 people a year, including field trips that are free for all 3 local school districts in the county that are in LOT's service area. With the support of our community partners, it is our mission to approach climate change education through a lens of hope, creativity, and action. Thank you for recognizing this day of action.
Thanks. Any questions for them? Okay, then we will go ahead and read the proclamation. And are you okay starting, Tanzania?
Yes. Thurston County Proclamation, International Day of Climate Action. Whereas International Day of Climate Action is observed on October 24th each year to raise awareness and inspire meaningful action to address climate change, protect the planet, and build a sustainable future for all. And
whereas climate change threatens public health through extreme weather, pollution, food insecurity, and disease, and the Thurston County Board of Health affirms that local climate action is vital to protecting current and future generations. And
whereas air quality in Thurston County is good, in the past year, 92% of days had air quality rated as good, with 8% of days rated moderate. And
whereas the 2025 theme for the International Day of Climate Action emphasizes the power of individual and collective action, from planting trees and conserving water to supporting clean energy and protecting biodiversity.
Whereas Thurston County residents are invited to participate in community events throughout October that promote environmental stewardship and ecological education.
Now therefore be it resolved that the Thurston County Board of Health hereby proclaims October 24th, 2025 as International Day of Climate Action in Thurston County and encourages all residents to participate in local events, adopt sustainable practices, and advocate for policies that promote environmental health and climate resilience.
I'll invite everybody into the lobby to the stairs for a picture. All right, the next order of business is an opportunity for the public to address the board, and there is no comment today. No one has signed up. So we will go on to a presentation of the Thurston County on-site sewage management plan update, and Susan Long and Jean Frost from Environmental Health are here to present. Oh, and then do I need to approve the public meeting? I need to have a motion.
Chair's questions. Approve the public meeting.
Do I need to do a motion to approve scheduling a public hearing during the December Board of Health meeting? Like, is that part of this?
that'll be towards the end of the.
Okay, all right. So we have a presentation first and then, okay. Got it.
You have the public hearing at 4:15 as well.
Okay.
So that's why we're just quickly deciding, so we can go ahead and get started. We'll probably have to pause at some point to do the public hearing.
Okay.
All right. Good afternoon. I'm Jean Frost, the Senior Environmental Health Specialist leading the Septic Operation and Maintenance Program. I'm here to provide an overview of Thurston County's, the update of Thurston County's on-site sewage system management plan, also known as the local management plan. In addition, I will be requesting at the end of this presentation to schedule a public hearing in December for this plan. I will begin this presentation with a brief overview of the history and requirements of this plan and and then move on to the purpose of the plan. Next, the process of the 2025 update, followed by a status of the 2016 plan recommendations. and then go over a big picture overview of the 2025 recommendations. And then finalize out with the strategy that we've implemented for the public comment outreach, and finally a discussion of next steps in implementation. There we go. To start with background, during 2005 and 2006, state laws regulating septic systems were adopted or updated. These laws included requirements that all Puget Sound counties develop a management plan for septic systems within their boundaries. In response to these regulations, Thurston County developed in 2008 and adopted its first on-site sewage system management plan. Then in 2016, the county updated and adopted a new version built upon the recommendations from the 2008 plan and actions also addressed in that 8-year time period. Since the adoption of the 2016 plan, significant progress and improvements have been made to address the 2016 recommendations. New water quality studies have been completed. Septic performance data has been collected and analyzed to assess the effectiveness of past strategies and identify ongoing gaps. Plus, statewide regulatory updates occurred in 2025, which requires local health departments to develop or update these local management plans by April 1st, 2027. So over the last year, environmental health has undertook the process to update the 2016 plan. So what is the purpose of this management plan? It establishes a shared responsibility model between septic owners and local health departments. This plan outlines the county's responsibility to ensure that resources and services are in place to prevent, identify, and correct failing septic systems and protect water resources, to educate, inform, and assist septic system owners on how to properly maintain, repair, and replace their systems, to create a more accurate and detailed inventory of septic systems so that all owners may receive information they need to properly maintain their systems. And finally, help owners to access existing grant and loan programs that reduce the financial burdens associated with maintaining, replacing, or repairing failed septic systems. This updated on-site management plan ensures the county remains compliant with new state requirements while continuing to improve septic system management and protect water quality in our community. On this screen is a Gantt chart outlining the last year work we have undertaken with the assistance of a consultant, Green Economics, to update the plan. The process began with reviewing and analyzing Thurston County septic data and programs, requirements, water quality information, and state laws. Then the research team engaged with key stakeholders to help shape the recommended actions in the updated plan. These conversations helped the team identify areas with water quality concerns, inefficiency in septic-related maintenance programs and process, and opportunities to improve overall septic system management. A final draft of the plan was completed mid-August of 2025. So as I stated earlier, each management plan builds upon the previous. This table includes a summary of the recommendations made in 2016, as well as the status of these recommendations. While many of the 2016 recommendations have been completed or progress has been made, those related to marine recovery areas establishment were not implemented due to limited financial and staff resources over the last 9 years. Recommendations that have not been implemented were reevaluated this time around using current information and discussed to frame recommendations for the updated plan. In addition, those that have been implemented were assessed for their effectiveness and used to outline needed improvements to our existing programs in the plan. So what does this plan and improvements seek to accomplish? There are 6 categories of recommendations outlined in this document. 1 is septic to sewer planning, which doing additional actions will enable greater collaboration between the county and cities to help make septic to sewer conversions more affordable. 2, designation of areas and marine recovery areas. Thurston County has 2 marine recovery areas, Henderson Inlet and Nisqually Reach. However, there are several other water bodies with poor water quality trends that have not been given this more sensitive designation. Water bodies that fail to meet bacterial and nutrient standards, including Eld Inlet, the Bud Inlet Deschutes River watershed should receive protection to help reduce pollution, including septic runoff. In addition, Summit Lake should also be designated a sensitive area due to its importance as a potable water source and its history of harmful algal blooms. 3, databases and dashboards. The county is in the process of switching to a new permitting database with a public portal. This will allow folks to renew their operational certificates and make septic-related payments online. Building off this momentum and in an effort to improve program transparency, we recommend a septic database and functional dashboards, which will provide detailed septic information for county staff to use as well as public. 4, climate change. To comply with updated state requirements, the management plan must consider areas where sea level rise and other climate changes may impact septic systems and result in an increased public health risk. Developing a plan to identify these potential impacts will protect Thurston County residents and waterways in the years to come. 5, quality assurance control. We need to establish a robust quality assurance and control program for our septic system inspections and development of performance metrics for all septic related programs in the county. And lastly, our county-led septic-related programs. The county has several existing programs in place that have helped increase septic system compliance, such as time of transfer, riser rebates, small grants, operational certificate program, pollution identification and correction, educational workshops, etc. Expanding the reach and funding of these programs will improve effectiveness and help the county better serve its residents. So this is a table that shows the recommendations and programs outlined in this plan. It notes whether an existing program and funding source and the current funding source. The top 7 that are bolded and underlined are existing county programs. So on to our outreach strategy to solicit public comment and feedback on this plan. So we included a presentation, we conducted a presentation of the recommendations to the Nisqually and Henderson Inlet Shellfish Protection District for their feedback. As part of the MRAs with the most stringent septic system maintenance requirements, we thought that they would provide the most interest and feedback. Starting in September, we started publishing social media posts regarding our public comment in the website. A constant contact message was sent to certified septic professionals about the updated plan and request for feedback. In addition, I will be presenting an overview of this management plan at the annual Thurston Septic Professional Summit, November 6, 2025. We also emailed key wastewater and water quality partners requesting feedback, developed and posted flyers in the monthly homeowner self-inspection classes at the atrium in the environmental health front desk and at the building development center with a QR code to the public comment webpage. We have already received public comment from 1 septic professional, inquiries from the city of Tumwater and other jurisdictions, as well as feedback from internal local county departments. So next steps, implementation. We are currently at phase 1 adoption of the 2025 on-site management plan update. Today, we are requesting approval to schedule a public hearing in December for this plan. Phase 2, 3, and 4 will occur over the next 5 years. So over the next 2 years, we will work with this Board of Health to evaluate sustainable funding mechanisms to prioritize the recommendations in this plan. 3 and 4, over the next 5 years, we'll prioritize designation of marine recovery areas or sensitive areas due to their importance to public health and impact on critical industries such as shellfish and recreation. We'll also strive to increase notification and oversight of approximately 40,000 septic systems outside of our current operational certificate programs and grant project areas. And lastly, again, over the next 5 years, continue building on our existing programs, leveraging current initiatives and partnerships to make steady incremental progress toward full implementation of this plan's recommendations. I want to take the time to thank our key stakeholders that helped develop these recommendations in this report. Green Economics, especially Sabine Postma, who's online, and the environmental health team as a whole for their assistance in updating this plan. Thank you for your time and attention. I'll now take any questions.
Any questions?
I know that's a lot of information. I'll recognize.
Very well done. All right, if there are no questions, is there a motion to approve scheduling a public hearing during the December Board of Health meeting?
Second.
Commissioner Mejia and Commissioner Clough. All those in favor?
Aye.
Any opposed? So, motion is approved.
Thank you.
So now, the Board of Health will now hold a public hearing pertaining to proposed updates to Articles 1 and 2 of the Thurston County Sanitary Code, and apologize for being 10 minutes late.
All right, Dr. Jen Freiheit, Public Health and Social Services Director. Thurston County Public Health and Social Services is proposing code updates to Article 2, which governs food services within Thurston County, and Article 1, which directs enforcement actions. Article 2 updates will include aligning with the adopted WAC 246-215, incorporating existing policies, clarifying local requirements, and broadening our enforcement authority. Article 1 reflects the enforcement updates proposed in Article 2. And I will turn it over to Season Long, our Environmental Health Division Director, who will walk us through the division's education and outreach efforts, as we heard your call to do stronger education and outreach efforts. And so we responded to that. And then Jesse Smith, our Food Program Manager, who will go over a few highlights.
Hi, Season Long, Environmental Health Division Director, Public Health and Social Services. So as Jen mentioned, Article 1 and 2 were brought to the board on August 12th. At that time, the board requested the Environmental Health Division conduct more education outreach with our food facilities and reach out to the Thurston County Chamber of Commerce to ensure participants that attended the Washington Hospitality Association meeting in June were invited to provide public comment on the proposed code updates. The board recommended we reschedule this public hearing to adopt the code in October once we had performed these tasks. In late August, we were able to compile a list of individual food permit holders. It was in the number of 1,262. These individuals are not all food facility owners. They could be consultants or contractors that submitted plans on behalf of facility, but they are all individuals that work in one form or another in the food industry. Additionally, we were also able to reach out to the Thurston County Chamber of Commerce, and we're able to get a list of 8 attendees that participated in the Washington Hospitality Association meeting in June. Division sent an email to these stakeholders in both English and Spanish on September 5th, inviting them to provide public comment on the proposed code updates. The email included the summary of changes and a link to the public comment portal in both languages. As of today, we still sent 1,262 emails. 661 were opened. 32 links, clicks were on the summary of changes in English. 40 clicks were on the summary of changes in Spanish. And 70 individuals clicked on the public comment link. We also posted on Facebook in September and then again on October 7th, where we received 1,128 views. So far, we have received 0 public comment.
This is on page 16 of your packet, and pages 17 and 18 are the 2-page quick summary for your reference.
Sure. Jesse Smith, Food Program Manager. Try and keep it pretty brief since we went over it a couple months ago, but the basics of it are we cleaned up some language that's outdated, updated language and removed language to match, policies and WAC or regulations. Streamlining the operations for our restaurants that have catering add-ons, so it's easier for them to go to temporary festivals as far as paperwork wise. And then adding civil penalties and some civil infraction language for people operating without a permit. There was already some civil infraction language in Article 1, but we also added it to Article 2 now to try and help work on unpermitted operations. Those are the big changes, I would say.
Happy to answer any questions.
Yeah, it sounds like there's no public comment. No one signed up.
I just want to say thank you for the outreach, from where we were to this. It makes me feel more comfortable that, at least we did notify, individuals, so thank you.
Yeah, that's an impressive open rate.
I know, right?
God.
Can I ask a question?
Yes.
So the whole section on food worker cards is Xed out. That's just something that's not.
It's duplicative of state regulation and RCW, so it's just not necessary in ours.
Oh.
So.
Got it. I was like, man, did they do away with food worker?
No.
I just didn't add anything to the state regulation, it's just copying it essentially, so
Oh.
we didn't feel any need to keep it in our.
Thanks.
Anything else? Is there a motion to close the public hearing? Is there a second?
Second.
All in favor?
All right.
Any opposed? All right. Thank you so much for coming back, and that was a lot of work.
Thank you. Appreciate it.
And then do we need to do the motion to approve the ordinance for amending? Okay, so the motion to close the hearing is done, and now we need to do a motion to approve the ordinance for amending Article 1 and 2 rules and regulations of the Thurston County Board of Health governing food service and rules and regulations of the Thurston County Board of Health general provision. So is anyone comfortable making that?
So moved.
Any second? Second. All in favor?
Aye.
Any opposed? All right, so the motion is approved. All right. So the next order of business is to discuss proposed updates to the Board of Health bylaws, and Dr. Jen Freiheit will update us with that.
Great, thank you. This is in response to Commissioner Mejia's request at the May Board of Health meeting that we looked into the possibility of a youth representative. So I'm going to direct you to page 34, 35. It begins on page 34. Under Article 3, we had done some research as far as what a youth representative would entail, added it as a temporary for your perusal under composition. So highlighted in yellow are the edits. I just quickly want to run by the yellow highlighted in 3.5. There was some wording language that we cleaned up. Nothing substantive changed there. But 3.7 is a new add. So this is to simply state that a youth representative between ages 16 and 21 would come to the Board of Health monthly as an observer role and provide perspectives. So they could speak during any vote or motion. They could not, they will not have authority to make or second any motion, but, and they will be asked to vote, but the vote does not count against your 12 votes. So they will hold a seat, but not a seat that takes away from the current composition. They will serve a term of 1 year with the option of renewal at your discretion, and it will not count towards a quorum if they are here. So also, we approached the Community Foundation, who is willing to offer a $500 scholarship to the youth representative. And so they are waiting for any move forward on that. So that is a wonderful addition to be able to offer that youth to be able to come and learn about county government and boards of health. So that is the information on 3.7 that really sums up the youth representative. If you turn to page 36, there, I will address that next part in just a minute, but the youth representative first, and I'm sorry, that looks like there was a page out of order. So please turn to page 39, where we added the youth representative as far as attendance. So you'll see that we just added that in, but the bulk of the youth representative part was in 3.7. And then moving on to the concept of the second vice chair for mentorship opportunities, as we have discussed, that is on page 36, yellow highlighted, section 4.3 and 4.4. So is basically stating that the second vice chair will be mentored by the current vice chair, and then they will assume the responsibilities of the vice chair in the vice chair's absence. And so those two components are added there. So at this stage, we can pause and contemplate or discuss or
that would be great.
Yeah. So the second vice chair, I don't recall, like, was that somebody's suggestion? Or are we trying to solve a problem, or was it to build just leadership capacity within the, like, what's the?
A little bit of both. So it came out of an original suggestion from member Tanzania, and that was sort of to look at how we can build people up to then move to chair and the chair position and be mentored in that respect. And so the concept came up at the May Board of Health as a second vice chair. And so we did some research with Robert's Rules of Order that is allowable. So it is something that is that occurs in other boards to allow us to mentor that person and move forward.
So are you needing approval of the?
If you all would like
bylaws?
approval to amend the bylaws.
And are there
edits that
any
we've done.
other things that you guys think we are missing or other? Like we captured with the ones I've heard about.
I would like some clarifying. First of all, thank you. And I think the $500 scholarship is such an exciting thing, especially for a youth member. So I think that's really great. So thank you so much for that, Dr. Brayheit. My question in regards to the second vice chair position, I'm wondering, I guess, right, as our terms are about to expire, and so would it make more sense to have this approval, like, you know, instead of having to vote on someone next month, and just so it's all coinciding, the start time is basically what I'm asking.
Yeah, so like, should we do it in January when
Yeah.
everything? That makes sense.
Aligns together, that way we can,
And I don't think we outlined exactly when it can happen. So yeah, it could happen when you deem it so.
okay.
So what would be helpful to you? Should we put off approving the amendment?
Direction.
Is this just a discussion item today, or?
I move to approve.
So I would also quickly, sorry, would like to clarify something. My inquiry was specifically about mentorship. I just want to be very clear. This specifically, the second chair thing is not something that I asked for or I advised. I think it's a great mentorship opportunity, and I appreciate you guys hearing me on that. I just want to be very clear that this was not something, this is not a brain baby of mine. So I'm getting the information right now as well.
Yep, no, this was something just based on your comments that, you know, and just based on the other boards I serve on, you know, seeing how we can get more community members involved in those leadership roles, and was something that I proposed back in May to the Board of Health, and you know, the Board of Health at that time decided that it was a good idea, and that's why it's here now.
So we have this draft language that the board asked for staff to bring back. We do have the reconstituting of the Board of Health coming up, as was suggested, and change in leadership. So we could hold this item until those occur. But wanted to make sure that this language suits the needs of the board.
So will this hold up the youth representatives?
Oh, Wayne, do you have your hand up?
Yeah, I think, you know, Josh just said what I was gonna say, but I don't know why there's a, you know, like if, you know, the whole board has to be reconstituted or, you know, redone because of the new state law change. I mean, this is, I don't know if this is even worth a discussion worth having.
I guess the piece on the youth portion, it would be helpful to hear from the board if signaling that's positive, so that our staff can get back to the community foundation and let them know that it's potentially coming. Formal action to happen.
I think moving forward with the youth representative is something that I think if the board is interested, we can do now. And then I think waiting on the second vice chair, because we also, I mean, membership is another thing that, you know, we're gonna have to discuss in the future. So maybe kind of pausing on that and seeing like kind of where we end up and seeing if that's is that okay?
Yep, Commissioner Klaus.
I like the idea of not waiting on the youth part. But I also think it makes sense to wait until we restructure the Board of Health. And so I'm just kind of wondering timeline wise, like what is the board's, what are folks' thoughts on I mean, like, I guess, would we need to approve the bylaws? Or could we start recruiting for a youth representative to start in January? Like, what would that timeline look like?
So logistically, having recruited youth members in the past, it does take several months, like 6. So it could be quite a long time as we reach out to the schools and we try to, there would have to be some sort of application procedure and you all looking at the application. So it could be a while. So whether it has to be in the bylaws and approved at this point, and if you direct, we could start that process to begin to gather, how we would receive the funds, how we would distribute the funds, how we would do the application, and when we would all bring that forward. So we'd make a calendar for you of when that could all happen. I'm assuming you might want to have, as we've done with new members, the top 3 or whatever, come and do, mini interview or something like that. So we will bring all of that logistically forward for how that would look, but it will take some time.
Okay, so could we give staff direction to move forward with the youth component, knowing that it will take some time and then wait to update the bylaws officially until the restructuring has taken place? That work?
You have the comment?
No, I mean, you can, I have different
I
comments.
would say, Commissioner, that in order to activate the youth component, the bylaws have to be changed. And so if that's something the board wants to do, I would recommend you do that portion. Then the second portion about the vice chair could be talked about once the Board of Health has had the update about the reconstitution.
I had a question about 4.1. It kind of sounds like the language there just solves for a question. It says majority vote on an annual basis for all those positions. But it doesn't really need to be decided. Like, no one needs to fill the role right now.
My question was about the youth. So it says 1 or more youth representatives, and I'm just wondering, how is that going to be managed? Is it going to be just the board's discretion to put in we have a good applicant?
Just left that vague just in case you.
Keeping it vague,
wish
and
to
then,
do.
but now you're talking about $500 stipend, so if there's 2 or 3 representatives, who gets the stipend, or is it divided between them?
I would have to go back and ask Community Foundation if they would be willing to offer more, if we chose more.
If they weren't willing to offer more, would
Then
we
we'd have to
just
divide
split
it.
between, okay.
Right, that's right.
I have 2 more questions. The first one is there staff capacity for adding a youth representative? And do we have the structure in place to support that youth representative and staff in their mentoring and onboarding of that representative?
That is a great question. We do have capacity to be able to go through, as we will with new members anyway, that we'll have to do at this time to recruit and do the application process. So that should be relatively seamless. I think we would want to have a Board of Health member do the mentorship. I mean, certainly at the health department level, we could help support that. But to really have that mentorship in process at the Board of Health. So I think we can put together some more specifics logistically for that as well too, to have you all take a look at and see if that meets the need.
Okay, I think that would be great. I wonder about like any risks associated with having a youth member on the Board of Health either prematurely before like that scaffolding is in place logistically, or if there was an issue that, were to arise, would we have capacity to deal with that? How would staff need to be involved if there were any issues or concerns that the youth had? So just kind of questions I'm thinking through in advance in case maybe like it takes up more capacity than we might anticipate.
I think once the member is chosen, then they would get the emails along with all of you. They would be seamlessly integrated like they were the 13th member.
Okay.
Those are good questions. I think it also goes to definitely at the outset to start with 1. It says 1, as Commissioner Menzer mentioned, that it's open, but to start with 1 person one youth representative, get them going for about a year's period of time before the Board of Health can then think about expanding. I think that'll help a smoother integration of this idea.
Yeah, okay.
Like, what is the date again that we as a board are supposed to be reviewing the bylaws and sort of all of that change that's happening with the amount of members? I know you said that that's coming up.
We'd initially set up in our strategic plan every April, but then that's when the legislation came out and that sort of put a pause on the looking at the strategic plan along with the bylaws. So hence that's why it's been a little piecemeal. At our December Board of Health meeting is when we'll talk about composition because we will have had a chance to hear from the State Board of Health and have more information at that time.
There's some legal review that our prosecuting attorney's office is working through, making sure they get clarifying language so that we understand exactly how that the state's language plays out and applies to this local setting.
Do we need any particular direction or anything, or do you feel like you have what you need?
I have a proposal.
Okay, that'd be great.
So I would move to approve the Board of Health bylaws to include the youth representative language and table the second vice chair position for a future date.
All right, do you have a second? Okay, all in favor?
Aye.
Any opposed? All right, so I think you have your direction.
Start the process and bring back some more information for all.
I'll be switching to virtual.
Okay, thank you for coming.
Chair, quickly, so can I get, I'm just trying to so are you saying, and I just want to clarify, are you saying that we are going to address the bylaws in April?
That was how we originally had said.
Right, so how are we going forward? Because April seems like a very long time. Again, before this group actually reviews the bylaws and have some of the conversations around bylaws that we have said many times.
Or to address the bylaws in December because of the composition potential
Okay,
changes.
so we will go over everything then. Okay, thank you.
All right. So next order of business is the health officer and director's report, which is provided in the agenda packet beginning on page 39. And Dr. Freiheit would like to provide you.
Yes, thank you. I just wanted to talk because we are entering respiratory season. So I just wanted to take a minute to point out page 42 and just give you some quick updates. As you might have heard in the news, Washington is part of the West Coast Health Alliance. We are receiving a lot of information to ensure that we are in line and a part of that. Washington on page 42 on September 4th put out their statewide vaccine standing order for COVID-19, and the standing order is under the direction of the state health officer. And this is vital because it authorizes all the qualified healthcare professionals to vaccinate individuals 6 months and older, including pregnant persons and those who have contraindications to the vaccine. And then just last week, the feds did open up ordering for vaccine beyond the private supply, which was all that was available at pharmacies locally. So more vaccines should be coming, so that should take care of the surge and the request for vaccine, especially because it's October, it's a month to get vaccinated for flu and COVID. And so I just wanted to point that out, that there's lots of movement on that. We are collaborating with Snohomish, King, and Pierce counties health departments in order to coordinate our threshold dashboards and in order to coordinate our masking recommendations for healthcare and hospitals. So much more is coming out on that. We will send that out through the blast fax to all of our providers as we do any communicable diseases, but that was an important update. So thank you for offering me the opportunity to just let you all know about that, as we are, the country is looking at and predicting a pretty rough respiratory season, as we have already sort of experienced in the last 2 months. COVID did spike in August and early September, and lots of respiratory things still going around right now. So an early season.
Yeah, we got rhinovirus, we got paraflu. Flu A has hit Spokane and Idaho. It's coming this way. Yeah, and I like the chart that has how to decide whether you get COVID-19 flu or RSV vaccine. It's very easy to understand. Thanks for including that.
Thank you.
Great. So the next thing on our agenda is just any subcommittee report outs, and it sounds like we have kind of a combo report that Dr. Klaus, or sorry, Commissioner Klaus will do.
Yeah, you want me to go ahead and you can just fill in any gaps? Data?
Yeah.
Okay, so me and Perla both sit on education and outreach and data subcommittee, so we both have kind of the same info, but we got an update from, well, we got an update in September on the 26th, that we have received 1,700 responses to the 2025 community health assessment. So that's really good news. Good job to the public health team for conducting all the outreach and going to all the events and having all the tables to get as many responses as you can. We have also, let's see. So yeah, the public health team has also posted information on the community health assessment to several social media outlets. And there have been press, articles published as well. And now the team is conducting targeted outreach to increase responses from underrepresented groups such as veterans, individuals experiencing homelessness, Hispanic residents, and men. We have also had limited responses from Yelm and Bucota. So as the Board of Health continues, our individual outreach into the groups that we are a part of, there's, a request to try to get the word out to residents in Yelm and Bucota, veterans, men, and individuals experiencing homelessness, and Hispanic residents as well. I will say from personal experience, myself and my executive aide have been doing some outreach in the community, collecting responses, and it is a lot harder to get men to respond to the survey. They don't want to. In fact, there was one couple at the bus stop at the mall, and we approached them and asked if they would participate, and the man told us his wife will do it. So she did it. He literally just walked away and left her there. So we did that with her, but it is harder to get men to stop and respond for whatever reason. So if there are men in your life, or in the communities that you're a part of, please do push this out.
Jen's giving us a stink eye as you're talking.
Yeah, where's your responses?
I've done it.
Yeah, show of hands, men in the room.
Yeah.
Just kidding, I won't put you on the spot.
I will.
I also.
Why did Ty leave us?
Maybe he went to go fill out the assessment
Oh,
really
there you
quick
go.
before he leaves. But yeah, so definitely need more of those responses. Is Commissioner Fournier still here? Commissioner Fournier, we need Yelm and Bucota. Commissioner Grant, we need Yelm. So, yeah, getting the word out is important. I also have done some outreach in the jungle and got some responses in there, and I continue to do that as often as I can. So I'm trying to help with the individuals experiencing homelessness. But yeah, if there are any questions about ways to engage and ways to support public health, I know that there are a list of events that our staff team is attending, and there's always an open invite for Board of Health members, as long as we don't have a quorum, to join our team when they're tabling in the community. So that's really it for the outreach part.
Do we know when they'll close down? Do we have a date?
It's really winding down. The responses are winding down. So within just a week or two, we are statistically significant. So we will do some data cleanup and then extrapolate so that we can make sure that it's representative as much as possible. For the first year out, this is amazing. This is amazing. Thank you to all your help. That we had this number of response and some good lessons learned for next time in 3 years as well.
I will commit to bringing it up. We're hosting, along with Yelm, City of Yelm, we're hosting 2 upcoming civics workshops on October 20th and November 3rd in Yelm. And so I will make sure that at the very beginning, I stop and ask everyone to, the thing is it takes a little bit of time.
Yeah.
And so I will work really hard to get some in Yelm to fill it out, so.
Perfect.
Yeah.
Yeah, there are also QR codes. I've been taking QR codes and sneaking them onto the tables whenever I do, like, we did our TCMC retreat, and I brought some QR codes and kind of put the word out because those folks are climate advocates, and we want to make sure that everyone from every interest is represented. So I thought that would be a good opportunity to share the word. And also the Regional Housing Council put out a newsletter and included that in the newsletter. So hopefully we're getting more providers who can let their participants know if they have unhoused participants in their programs. So just trying to think creatively, but I would really appreciate that, Commissioner Grant, and I think our staff team would too, because I know a lot of work has gone into this, so. And then, are there any data related?
No, I think that's
Okay,
that's it. Yeah.
perfect.
Great. And then I heard there was no policy meeting, so there's no. Thanks for all that work. It'll be really interesting to see the results.
Yeah, I'm looking forward to it.
Okay. So next item on the agenda is open Board of Health discussion and information sharing. Let's see. So I just wanted to update a little bit on just some of the work that's been going on to make sure that kids in particular have all the respiratory vaccines. It's been a little crazy because the vaccine for RSV is very expensive. It's $550. And it was all this expiring stock out there we were trying to use up, and it was all across the state at not necessarily the right spots. And so we've been figuring out how to do transfers safely. And I think it's like over 200 transfers have happened to make sure that it's in the right spot for the right kids at the right time. And so even the hospitals and all the clinics and people are working really hard, and it was a pretty big endeavor. Flu vaccine is here and rolling out really fast, and COVID arrived on Friday for most people. So just wanted to let you know we're getting all the kids protected at least. And then hopefully it looked like the pharmacies were pretty busy getting all the adults. So I would say it's a perfect time to do it. So everybody protect yourselves. Let's see, and then let's see. Do you want to talk about the kind of leadership stuff for the new year, or anything else you wanted to call out?
Yeah, just to make the reminder that December we will be doing new elections. That we'll be talking about the composition. We'll have more information then, so we'll get into some pretty deep conversation in December on that. And we will need a new chair, a new vice chair, and we will fill a seat, or hopefully not more, that will be vacating, as Dr. Harvey will be vacating out of the Board of Health. So we'll need to fill that role.
Great. And we didn't get any emails about other information sharing, but just know we always welcome that, and great.
I could, we didn't send out an email, but the county is this week working with South Puget Sound College on some really great events. And so you are invited to both events if you can make time, Thursday, October 16th from 1 to 4. At the college in Building 27 Student Union. And then on Friday, October 17th, 6 to 9. And it's at the Mini Art Center, Building 21. This is a partnership with the South Puget Sound Community Foundation and Thurston County. And so I just wanted to point that out. Feel free to share it with anyone that you think would be interested in attending.
This will be led by Willie Frank Jr., so it's very exciting, and after the documentary, he will come and lead a dialogue with the community. So it's a very exciting, especially after yesterday Indigenous Day. So
At the same time as the Mariners game. I know, it's really unfortunate. I hope you guys don't lose some people because of that, but yeah. Not your fault, Mariners' fault. Yeah.
All right, so it looks like we will now meet in executive session to talk about the position of the health officer as allowed by RCW.
I'm so sorry. I didn't realize that we were done. I was waiting for you all because I had two things for the roundtable. So one, it is a little concerning to hear that we don't have a lot of Hispanic men represented, and I would imagine that may be in relation to things that are happening with immigration and ICE. And so I don't know how we can support that, just kind of staying up with there. We had a meeting with the AG today about different things that are going into place to really try to fight that. But that probably is a concern for a lot of Indigenous, Hispanic, and Latino communities. And so maybe keeping that in mind, they are about 10% of the population here in Thurston County. So it's pretty significant. And the other thing was regarding the policy subcommittee. Commissioner Mejia, I don't know how you feel about it, but I think I've expressed this a couple times, and maybe the December meeting would be a good place to also discuss it. But I'm not sure if that subcommittee is operating in a way that is being productive and impactful. So the presentation that we had today from environmental health regarding the changes and their plan for septic, that's something that we've spent probably the last 6 months or so as a subcommittee hearing them kind of build up to those changes. And if they're eventually just going to bring things like that to the greater board because they essentially have to get our vote, I'm not sure if that's the best use of time for the policy subcommittee. There's so much going on. There's so many things that we can be doing regarding policy and legislation. So I just wanted to bring that to the full board, something to kind of think about, planting the seed, and maybe we can have a deeper discussion about it in December along with the bylaws.
All right, anything else? Sure.
I have a question. When does the policy subcommittee typically meet?
Is it Tuesdays? Usually, is it? Oh, okay. Yes,
Yeah.
that day.
Okay.
It's usually Fridays. Commissioner Menser is the chair of that one.
Okay. I was just wondering if that, because I think that's an interesting point. I'm not on the policy subcommittee, but I think that's an important point because it is such an important part of the strategic plan. So I was just wondering if that's something, it sounds like Tanzania, your question is, when can this be addressed? And so I'm just kind of wondering, and don't let me put words in your mouth, but that's kind of the question I'm hearing. And I'm just wondering if there's an answer to that. Like, would it be something the policy subcommittee discusses and then reports back in the December meeting? Is that kind of how that would be handled?
Might be good to loop Commissioner Menser into the discussion as he sits. I don't know if he's the chair. He's the chair of it.
Okay.
So I think that are you you're on the policy?
I am, and I've kind of, within the subcommittee, I've expressed this several times. And I think, and I don't want to speak for him because he's not here, but I do believe that, oh yeah, he's here. But Clark is also on that subcommittee with us, and there's not, I mean, just from my perspective, right? Like, if that's just sort of the way it's ran and that's how it's kind of happened in the past, like, that's good for me to have that learning. Like, oh, okay, this is just how it goes. But it feels like it's just sort of filled up with people coming to present to us. Like, we have 1 hour and the hour is filled with people presenting to us. There's not a whole lot of us discussing specific initiatives or proclamation related intentionality to put policies in place for other things that we're doing as a board. None of that's happening. And so maybe I just misunderstood what the subcommittee was going to be or what the work was. But yeah, I think Commissioner Menser is pretty aware of my feelings around this. And I guess I didn't realize that was something that we could have a discussion internally about. So maybe that would be the best course of action. I'm not sure. I do appreciate you asking that because, yeah, that begs to, is that something that maybe we should address in the next subcommittee meeting as a committee and then try to bring something to the fuller board?
Can I ask a follow-up? Because I wasn't at the last policy subcommittee meeting, but I remember seeing your email and I thought it was going to be discussed there and.
Through email or at
at the last policy subcommittee
and we
meeting.
didn't have one.
So just for a quick brief, is the strategic plan hasn't even been in place a year. The committees, haven't even been in place. Several have gotten canceled because we didn't have a Board of Health clerk for a long period of time and all that sort of thing. So I think that definitely all the subcommittees are a bit struggling, and so that should come up when we discuss the whole strategic plan in general and what the purpose of those subcommittees are. You know, initially it was to meet monthly. I think that could potentially be too much. We need to redesign what the purpose of the subcommittees are and what needs to come out of that. How the policy subcommittee on their first two meetings decided that they wanted septic to be the top policy issue. And that is why all of that is coming forward. As they reviewed all various kinds of legislation and policy things, and they said, we want to move forward with that. So that is why that is the main driver of the agenda in the last 9 months.
And if septic items need the full vote of the board, then they have to present to the full board. They're gonna have to come and all of you need the same information.
100%. And that's kind of my point, like, why would that be the sole focus and the purpose of the subcommittee when they have to come to the Board of Health to get our buy-in? Like we as a board have to vote, like we as a subcommittee can't make those
It
decisions.
sounds like the subcommittee has that to be.
Specifically, you are reminding me that, yes, specifically Commissioner Mensah was like, this is my baby. I've been kind of working a lot of septic stuff for a while. So I do remember him saying, but what was the second focus? Because if it was two policy areas,
The second item we resolved was, should the Board of Health have purview over social services or the social service side of the house? And so we got the legal opinion on that. And yes, there could be more proclamations, more action, more legislation looking at on the social service side of the house, not just the public health side. So those were the two big items that came out of those early meetings.
I do remember that. And that was pretty huge because the understanding that I got is that we have a pretty large legal scope as a board, and there's quite a bit that we can do and change within the county. Like we have a purview and scope that is a lot of ability and a lot of access to be able to actually make some change. So that's a big one that there hasn't been a lot of discussion or movement about that since. So I think December is going to be exciting because there's just a lot of really good, important stuff to kind of dig into.
And I do think I can understand why the septic would be a topic because of the other inlets and things that potentially haven't been in those special zones that I know that's been part of the discussion, and then the climate impact and the public health impact of that. I think I can see why that, if you have to pick one, like that might be something that.
And it's timely, like he made a very good argument for why it's important. There's been a lot of like groundwork, a lot of big necessary changes. I just mean.
We had the piece come before us.
100, right, that's a representation of why it's important, yeah.
Great, well, I appreciate the input and feedback, and we will, I'm sure, take it moving forward. Great. All right, so you ready? All right, sure. So the board will now meet in executive session pursuant to the position of health officer as allowed by RCW 42.30.1101G. The board will be in executive session for about 5 minutes until 5:13. All right, I call the regular meeting back to order, just so that we can do our next agenda item, which is to take a motion to adjourn the October 14th, 2025 Board of Health meeting. Anyone like to make the motion?
Move to adjourn.
All right, any second? All right, all in favor?
Aye.
All right, see you in I guess 2 months for me, but you guys will see everybody in a month.
These were left by one of our guests. If you'd like to take one on your way out.